Hello, this is Dr. Janet Piscatelli, Vice President and Chief Laboratory Officer for Quest Diagnostics. When our customers use a Quest Diagnostics product or service, they put their trust in our consistent and uncompromising quality. This absolute standard of excellence is instrumental in achieving our objective of creating a healthier world. Our diagnostic insights, your insights, will inspire actions that can literally transform a life. This presentation is intended to remind you of the vital role you play in our quality program. Our quality policy statement is a strong aspirational goal to provide every patient and every customer with services and products of superior quality. You and I, and all our coworkers, must be committed to following our quality procedures and to live the principles of everyday excellence. We must incorporate the QMS principles of planning, performing best practices, checking the effectiveness of our plans, and then taking actions that will continually improve our products and services. If you think an approved procedure doesn't work well, raise the issue with your supervisor. Don't take it on yourself to change the way things are done. Developing best practices is a team effort. If you see a violation of procedures, bring it to the attention of your supervisor, manager, or medical director. Remember, the duty to report applies to quality. Our quality policy is the foundation for our comprehensive quality program that includes hundreds of policies and procedures that ensure we meet or exceed the regulatory requirements established by the Clinical Laboratory Improvement Act, or CLIA, and enforced by CMS and the CAP. The quality framework, which was the subject of last year's annual Code of Ethics training, is a high-level summary and is approved to share externally. This year's Code of Ethics training will be limited to Section K of the framework, entitled Quality Assessments. This section discusses how we assess our quality using mechanisms such as the internal audits, or how we assess quality using external agencies. Proficiency testing is when one of these external agencies sends us an unknown sample for testing to see if we can achieve the same results as other labs. I will now turn over the presentation to our subject matter expert concerning regulatory affairs, Christine Sable.
Hello, this is Christine Sable, Senior Director for Medical Operations and Regulations. As Dr. Piscatelli mentioned, this year's training module will focus on various aspects of the proficiency testing program at Quest Diagnostics, including the what, why, and who of proficiency testing, which regulations and accreditation requirements are applicable, the enforcement actions and consequences for not complying with the requirements, some tips for meeting the requirements, and additional resources that are available to you. Proficiency testing, also known as PT, is the testing of unknown samples from an approved provider to demonstrate the laboratory's ability to provide accurate and reliable results in its patient's testing system. Proficiency testing is performed to assess and monitor the laboratory's quality through the evaluation of test performance against pre-established criteria. The College of American Pathologists, or the CAP, is a CMS-approved provider of external PT surveys and Quest Diagnostics' primary provider. For tests not covered by the CAP, laboratories enroll with other CMS-approved PT providers. The regulatory requirements apply to all PT providers equally. Each Quest Diagnostics laboratory participates in external PT as required by federal regulations to monitor the accuracy and reliability of test results. The Clinical Laboratory Improvement Amendments, or CLIA, regulations state that the laboratory must participate in a CMS-approved PT program for all testing listed in Subpart 1, referring to the non-wave testing. Tests listed in Subpart 1 are referred to as regulated analytes. The CAP requirements, which are based on the CLIA regulations, apply to both waved and non-wave tests, and further define, to meet CAP terms of accreditation, the laboratory must enroll in CAP-accepted PT program. In the event that there is no CMS-approved or CAP-accredited PT program for an analyte, the laboratory must, at least twice annually, verify the accuracy of the test procedure. This is accomplished through an alternative performance assessment. The CLIA regulations and CAP requirements are outlined as shown here. Alternative Performance Assessment, or APA, is a system for determining the reliability of the laboratory examinations for which no commercial proficiency testing products are available. PT providers do not always cover all of the laboratory's test offerings. In order to meet accreditation and regulatory requirements, laboratories must perform APA semi-annually to monitor the reliability of testing. The laboratory has several options for APA testing, such as split sample testing with reference or other laboratory by a different method, split samples with established in-house method, assayed samples or materials, or participation in graded, ungraded, or educational PT challenges. The CLIA regulations and CAP requirements are very explicit when it comes to handling PT samples. They define that PT samples must be tested using the same personnel and routine methods as patient samples. There are a few exceptions for histopathology testing, which will be addressed later. The laboratory must test samples the same number of times that it routinely tests patient samples. PT samples can only be repeated if they meet the criteria for a repeat as stated in the assay's SOP. Interlaboratory communications pertaining to the results of proficiency testing samples is prohibited. The laboratory must not send or receive PT samples or portions of samples to or from another laboratory for analysis. Here are some helpful tips for PT testing and avoiding mistakes in handling PT surveys. Test the PT samples as you would patient samples, except when a sample is routinely referred to another laboratory. Do not accept or test PT material from another laboratory. Do not refer any portion of a PT sample to another laboratory. Do not communicate PT results or information about active surveys with anyone outside of the four walls of your laboratory. If you find any inappropriate referral of PT materials or results, notify your QA department or corporate medical operations. Keep in mind that even though PT surveys may only cycle through your department 2 or 3 times a year, any other lab can make a mistake in referring their active PT surveys at any time. The potential for inappropriate PT handling is always present. It is up to all personnel to understand these rules and to do their part in being vigilant about inappropriate PT handling. Be especially watchful for potential risks during an active survey. This may help prevent the consequences of mistakes with handling PT. Inappropriate referral of PT testing can have negative consequences for individuals as well as the Quest Diagnostics organization. Regulations require that actions be taken and penalties be assessed depending on the severity of the inappropriate referral. This may include revoking the CLIA certificate, imposing sanctions including civil money penalties, or following a directed plan of correction. Here's what it means for our patients, the company, the laboratory director, and employees. If a laboratory's license is revoked, patients' access to timely care can be affected as the testing would no longer be performed at the laboratory. Quest Diagnostics may have to pay civil money penalties and/or no longer be allowed to bill for services. The laboratory director could lose their license or have it suspended, and other employees may face disciplinary actions up to and including termination. There are exceptions to handling of PT samples in certain circumstances that must be understood in order to avoid mistakes. Reflex testing, confirmatory testing, and testing sent out due to problems with the ability to perform the assay all present situations where PT is not handled as a routine specimen. There are also exceptions to handling of PT samples, but only for a select few processes related to anatomic pathology. CMS allows for staining to be performed at another CLIA laboratory when the referring lab does not perform this process. However, there is clear distinction between a process and analysis. Analysis for IHC slides must always be performed where the patient interpretations are routinely performed. This slide discusses how to avoid inappropriate PT communication. If you are faced with a situation and you ask, "May I discuss my PT results with another laboratory?" the answer is no, never. Never enter into discussions with another laboratory about their PT results before the results are evaluated by the PT provider. This activity may result in sanctions taken against your laboratory. This includes all forms of communication, including email, voicemail, texting, and personal communication. The only communication that is permitted outside the laboratory is with the PT provider. Another question one might ask is, may I send my PT samples to another laboratory to see if they get the same results as I do? Again, the answer is no, never. Do not send or accept PT samples to or from another laboratory for any reason if you send your routine patient testing specimens to another laboratory. Make sure to read the PT results sheets carefully and follow the directions. Test the PT sample up until the point you would refer a patient specimen to a second laboratory for further testing, for example, for confirmatory or reflex testing. Then select Would Refer or Test Not Performed in these instances on the PT results sheet. Do I test PT samples the same as I test patient specimens? Yes. The laboratory must test samples the same number of times that it routinely tests patient samples. PT samples can only be repeated if they meet the criteria for a repeat as stated in the assay's SOP. May I take active PT slides to another lab for reading and reporting? No. Never send or accept PT samples to or from another laboratory for any reason. The slides must remain within the four walls of the laboratory. What if I work at two different CLIA laboratories, even if it's two Quest Diagnostics laboratories? Laboratories that share a common computer system or personnel must have strict policies and procedures to ensure that personnel do not access proficiency testing records from other laboratories. Never refer a PT slide to another laboratory, even when their technologists work at both laboratories. In these next few slides, we'll cover the quiz review. The first question, I must test PT samples the same as I test patient specimens. The answer to that is true. The same number of times as you test patient specimens, at the same time as patient specimens, by only one of the same personnel that routinely tests the patient specimens, using the same test system, including analyzer and reagents. It's important to rotate among testing personnel within your laboratory, including rotation among pathologists that routinely report HER2 and ER/PR testing. Follow the repeat criteria defined in the SOP. Our exception are for samples that require special treatment prior to testing, according to the specimen handling and preparation sections of the proficiency testing booklet. After preparation, however, PT samples must be treated in the same manner as patient specimens. The second question, I may email or text others about my current PT event? False. During an active PT survey, do not email, text, or discuss any details about the PT survey with anyone within or outside of your laboratory. Our quiz continues with the question, I may send my PT to another laboratory to see if they get the same results. The answer is false. Never send your PT samples to another laboratory for any reason. Even if you send your routine patient specimens to another laboratory, you may not send them in order to do a comparison to get see if you get the same results. You must read the PT sheets carefully, follow the directions, and if you come to a point where you would refer a patient specimen to a second laboratory for further testing, select Would Refer or Test Not Performed in these instances on the PT results sheet. There are many resources available to you regarding the proper handling of PT samples. If you have any questions, feel free to reach out to your local Quality Assurance Department or Corporate Medical Operations and Regulations team. Thank you for your time. Remember that the commitment to quality is every employee's responsibility, and proficiency testing is a very important part of this.